Hi, my name is Samantha Pahls, and I am a Hi, my name is Samantha Pahls, and I am a student at the University of Arkansas for Medical Sciences, getting my master's in public health, specializing in policy and management. The title of my applied practice experience is Aurora Death Criteria of Organ Donors, looking at the criteria of organ donors by looking at the death records from the Arkansas Department of Health and the CDC to increase donors by regulations of the CMS. Problem. For my applied practice experience, we were looking at the problem that problem. For my applied practice experience, we were looking at the problem that 17 people die a day waiting for an organ that can save their lives. This is the issue that this project is addressing for the Arkansas Regional Aurora Recovery Agency. The Center of Medicare and Medicaid Services has an audit every 4 years, and Aurora is the organ procurement organizations that is vital for the procurement, distribution, and transplantation of human organs in a safe and equitable manner for all potential transplant recipients. This semester, I worked with Dustin Gold, starting the process of getting ready for that audit that will happen in 2024. The Arkansas Regional Organ Recovery Agency's mission is restore lives through the recovery of organ and tissues. They are the agents in restoring life for those who are in need and freedom from pain. The name Aurora is an agent of healing and meaning to so many families all around Arkansas. Their motto is "We restore lives," because that is what they are aiming to do every day between their medical team of nurses, physicians, medical technicians, social workers, and administrators. This medical team is not just putting their needs before others, but they are truly saving the state's population through love and healing. The 3 organ transplants in Little Rock, where the hub of Aurora is located, is Children's Hospital, Baptist Health Hospital, and our own University of Arkansas for Medical Sciences. These 3 locations transplant heart, liver, and kidneys to our community within doing close work with Aurora. The mission of the OPOs is to unite and strengthen the donation and transplant community to save lives. They are not for profit, and they follow the national policies to ensure that the best matches possible for organ transplantation and donations. Each of the OPOs are selected off by their services areas, and because of these 57 organizations, the United States system is known as one of the best in the world. The National Organ Transplant Act of 1984, NOTA, was enacted to help ensure the organs allocation process is carried out in fairness and effective way, leading to an equality service for all organ procurement and transplant networks for matching donors' organs on the waiting recipients. The OTNP is managed by the UNOS, and all 57 OPOs use UNOS to prioritize computer system to match and place organs that they procure. The way that these reports are recorded are 3 tools to improve the OPOs. These tools are the Organ Utilization Tool, OPO Benchmark Report, and the Recovery and Usage Map. The Organ Utilization Tool helps the OPOs with the increased organ recovery rate by looking at the outcomes data. The OPO benchmark report helped compare the performance of all OPOs nationwide to help improve the process of the recovery and placement process. And lastly, the recovery and usage maps provides information and detailed report on how to recover and the risk. The OPOs also have a networking business with the hospitals in their service areas to combine their forces that are making the best practice is being put to the front of the hospital's effectiveness. A way that this is being achieved is through the collaborative innovation and improving network. The work that I did with Aurora was crucial for their preparing for their audit that is coming up. Our plan was to get records from the Arkansas Department of Health and the CDC to compare those to the records, the death certificate records that Aurora already has, to see if there's any numbers that were off place, to make sure that the Aurora is certified and gets a good grading on the next audit. The CDC death records were sent over in code, and we had to figure out a way to export this into a document of the death records for 2018 and 2019 into a format where we could sort through this information. As you can see in the picture, this is the example of what some of the codings looked like. The main things that the organization wanted to look at is how the individual passes, age, any health problems of the individual, and any main criteria that might exclude them from being an organ donor. I helped by starting this preparing for this audit by making the connections and getting the records and helping sort through them with the help of my site preceptor. The record layout for the mortality files with all counties, geographical information that we got from the CDC had a list of data elements in their file location. This is what you are looking at in this picture. Every single letter and space has a meaning on this data sheet, and so we had to figure out what the importance of each of those were. The records we got were from the years of 2018 through 2019, and this information we are sorting out through the information that includes residential status, place of death, date of death, occurrences, resident status, underlying causes, multiple conditions, other medical items such as the autopsy, detailed age report, marital status, method of disposal, tobacco use, certifier, race, and other important factors about this person and how they died. This was a complex document and format to decipher through. And the process of getting the document was also very difficult and had to jump through a lot of hoops from the CDC to get this information over to us. We are still getting the documents from the Arkansas Department of Health, and currently our current status with that is that the Arkansas Department of Health is having a science advisory committee this month that we recently got back to us, and they told us that we had to change our approach of how we were going about asking for them, but we are going to end up getting those death certificate records. Aurora is actually omitted from HIPAA, and so all of this information is they are already sharing it with us through an individual standpoint, but to get mass records like this, we had to go through a lot of legal and ins and outs of this process. Even though we did not get to complete the initial start. I'm proud to be a part of the start of Aurora's preparation for the audit that is coming up soon. The reason behind this audit is to make sure that the maximum people possible for transplantable organs is available for those who are in need to help them save lives. For this CMS review, the OPO's performance that are responsible for identifying the eligible donors and recovering organs from the deceased donors in the states. The underperformers had a consequence of poor performance, and this can affect the credentials of the organization. For Aurora, it is very important that they get good ratings because they are our community, and we are this section of the state that they are in. So each OPO has their own area of where they work, and so Aurora is our Arkansas's. This system is in place to prevent any avoidable deaths in the state. There are 57 OPOs set in place currently, and they must abide by the Social Security Act and the Public Health Act, Section 1138 of the acts, to show the requirements that abide by the organ procurement costs to be made under the Medicare and Medicaid program. These are just two of the government agencies that regulate and inspect the organ transplant system. The CMS audit is every 4 years, and they have to survey the OPOs to certify them on basis to see if they are up to standards on their in and out measures. And the audit in 2024 will actually start to begin this next upcoming year in 2022 and will be implicated for recertification in 2026. The new revisions that this next audit are being implicated are so critical to the lives that they may depend on. And this project is helping them get ready for that, so that the performances of Aurora is closer to the top 25%, which is what you are wanting to aim for. The scoring system is out of a 1 to 5, and 5 being the best. And so if you get scored under a 3 for this audit, it actually, you get your certification taken away. This experiment I got to have with Aurora was very interesting, and I learned so much from working with them. This organization and Dustin God were a blessing to work with, and very understanding and helpful the whole time. I am honored that I get to spend the opportunity to spend my semester with Aurora and getting a jump start on getting ready for the audit that is going to start in 2022. I am continuing my work with Aurora for my ILE project that is coming up this next semester. And I also told Dustin that even though our project is done, is that I will see through getting the Arkansas Department of Health records with him even after the semester is over. I would extremely encourage anyone to get a part of this organization and that see that the incredible opportunities that they are giving the community of Arkansas. That concludes my presentation for Aurora and the CMS audit that is coming up, and my work that I did with them this past semester. Thank you so much, and I hope you enjoyed the presentation. Here are the references that I used for some of the information involving the organizations and the legal documents.